Hi, good afternoon, everyone. I'd like to welcome you to today's webinar entitled Developing Clinical Judgment with Today's Nursing Students, presented by Brent Thompson. My name is Brian Carey, Vice President of Marketing here at Unbound Medicine. In this webinar, we will be discussing how is the NCLEX RN changing to measure clinical judgment? What is the new model of clinical judgment? And how can faculty aid learning of clinical judgment using technology, such as Nursing Central as an example? The webinar will be about 30 minutes with some time for some questions at the end. Please submit questions in either the question or the chat areas in your webinar screen. If we don't get to your questions during the live presentation, Brent will answer and reply via email to the entire group. This webinar is being recorded, and we'll send a link to everyone in about a week so you can share with your colleagues. Let me briefly introduce our presenter. A pediatric nurse since 1980, Brent Thompson earned an MSN from the University of Delaware, and following that, a Ph.D. in nursing education from Widener University. He has been active in teaching the use of technology in nursing education for over 20 years and has presented at a number of conferences, including the NLN and the STTI. Dr. Thompson recently retired from Westchester University of Pennsylvania as an associate professor after 17 years of service, and currently is a consultant and an advocate for the use of technology to assist nurse educators in active learning strategies in the classroom. At this time, let me introduce Brent Thompson. Take it away, Brent.
Well, thanks, Brian. Thanks to everybody for joining us today. It's a snowy day here in Philadelphia. I hope weather is better where you are, or if it's not, this is a great day to be inside listening to a webinar, I hope. So as Brian mentioned, our objectives for the day are to look at some of the changes you may have heard about that are coming into the NCLEX exam. And those changes are particularly focused on measuring students' ability to demonstrate clinical judgment. And the NCLEX, the National Council of State Boards of Nursing, is using a new model of clinical judgment, which is an evolution of the models that you probably are already familiar with. And we'll talk about those briefly. And then the bulk of our class today will be talking about how you as faculty can help students learn clinical judgment and demonstrate clinical judgment in a classroom setting. So our focus today is going to be on classroom teaching of clinical judgment. Now, something that I was very pleased actually to see this quote by Philip Dickinson of the National Council State Board of Nursing, because he's been saying what I've been saying for a long time, and that is we need to move away from focusing students on memorization. So in fact, instead of learning a long list of interventions that go along with a certain disease process, students need to be able to use resources as they need them. So his quote was, students don't need to memorize 25 sets of drugs. That's not how we work anymore. I have a reference library. I have a phone. Students can simply type in a question and see what the drug guide might say about it or some other reference. So what he's saying there is that we need to get students to use the resources as they need them and to move away from having students to demonstrate to you how much they've memorized. So what Philip talked about, and you can find this on the link to the National Council State Board of Nursing that I have at the bottom of the slide there. But going back about 6 or 7 years, they were finding that employers, mostly hospitals, were unhappy with the clinical judgment skills of nursing graduates. And they said they needed to be able to improve the test so that students could demonstrate their ability to show clinical judgment skills. So in the middle of 2017, they began making some changes or testing some questions to see if we can get a better handle on demonstrating students' abilities to show clinical judgment. Now, they say they will not put any of these new questions on no earlier than 2022 or 2023, but that does mean that our current freshman class is affected by this. So it is not too early to start thinking about how you are teaching clinical judgment, and are you preparing your students today in class for clinical judgment. Now they have a lot of item prototypes that they're testing. They have what's called a special research section that students take after the end of the exam, where they're giving them case situations, and then they answer questions that are a lot, when you see them, they're mostly enhanced versions of methods that they're currently using. But they also require students to decide what's important and what's not important. And their overall goal is to simulate real life decision making. I urge you to go to that website and look at the next generation NCLEX PDFs that they've published that explain some of this in more detail. But today we're going to focus on clinical judgment and how the National Council is defining it. So what they're saying is clinical judgment is what's observable. And it's observable part of the mental processes that nurses do of critical thinking and problem solving. And those are not directly observable. So they're saying, but we can observe clinical judgment. So they're defining problem solving as developing, evaluating interventions within the context of nursing, and critical thinking using logic and reasoning to demonstrate the strengths and weaknesses of your solutions or the way you're practicing. So in short, problem solving is coming up with ways to solve the problem, and critical thinking then is showing how, or thinking about how you came up with those reasons and what is your support for those reasons. Now there's a classic view, and this is Chris Tanner in 2006 published her view by looking at all the literature and what's all been said about clinical judgment, and show that clinical judgment goes through phases of determining what patients needs, deciding to act or not to act, and if you act, what are those practices, what are those interventions going to be, standard, modified, or new, and then you evaluate them. In the fourth step, you determine the patient's response, determine the outcomes. What the National Council has done is proposed a next generation NCLEX clinical judgment model, or the CJM. And the big key to this is that these decisions that nurses make are done in context. So there's environmental factors and there's individual factors. Environmental factors could be things like the medical records, the time pressure, the complexity, cultural considerations, and just the overall environment that these actions are happening in. And then there's also individual factors like the student's own or the nurse's own knowledge and their skills, what their experience has been in that specialty, prior experiences, things like that. And then while I have them listed here in a linear fashion, I also want you to realize, and I'll show you in the next slide, that these are not straight, you finish one step and then you go to the next step. They are iterative, meaning that you go from one step and then you go backwards a little bit, and as new information comes and you refine. So it's a process of refinement as you go from beginning to end. This is a slide that I took the model, focused on a part of the model of the CJM from the National Council website. And you can see the 6 steps that I showed you there in the middle: recognize cues, analyze cues. But notice that those steps don't go straight left to right. They go, you start with the recognizing the cues, and you analyze them and you form hypotheses. And once those have been formed, you then go to the second step, which is refining them, where you prioritize them. And then after you've decided what's most important, you then go to coming up with solutions. Now, generating solutions is kind of like proposed interventions. So finally, you begin to take actions, and then as you're taking those actions, you're getting data. You're evaluating how well they're working, and that's part of evaluation. So you can see the iterative process there in that model, how the arrows that are going up and down, and then moving over to the right. And then at the bottom where it says context, just to remind you that all of these steps take place in the context of the situation that you're in and whoever is doing it. So some questions to ask yourself are, am I teaching clinical judgment in class, or am I focusing more on fact recall? And we've done classes before on active learning strategies, and you may be hearing some of that about that. And that's really what a lot of those active learning strategies are trying to promote. The idea of practicing clinical judgment. It's not just so it's more amusing or that you'll remember the facts better, which they do, but that you'll actually learn to be a better clinician. You'll make better clinical judgments. And the other question to ask yourself is, how am I testing my students? Am I just giving them a test after they've had a lecture? Or am I giving them multiple ways where they can demonstrate how well they're learning as they're learning the material, getting chances to practice? So you have to, I think, plan clinical judgment in every class. You have to address all those stages that we talked about, and it's also important that you give students practice time. Over the years, I've had a lot of students tell me that they never feel like they really got to practice the clinical judgment skills until they took the test, and then they saw, oh, okay, I'm actually, this is how I would actually use it, because they weren't given enough situations in class to help them practice. They may have seen a demonstration, but they didn't get to do it themselves. And the other key part of this is giving students immediate feedback, helping them know right away how well things are going. So we'll go through the stages and show you some examples of what tell you what the state board or state council is saying about these steps, how they define them, and then give you some examples of things that you can do in class to help teach them. So we'll start with the recognizing cues. So recognizing cues is identifying the relevant information from different sources. And some examples would be the history, the electronic health record, the medications that the patients are getting. So the students, in recognizing cues, then you have to look at your situation, you have to look at that case and saying what's information in this situation that I'm presented is relevant or irrelevant. And also start to ask, well, what would be most important to know? There's a lot of information that's nice to know, but what do I need to know? So as you can guess, this is showing why we really need to start thinking about using case study methods in teaching. Present students a history, signs and symptoms, medications, behaviors of a patient. So we'll start with a little situation. Now this is a very incomplete, and I do that on purpose because I think one of the things you can also do is get the students to start saying, well, what about this and what about that? What other information do they need? They start to realize that there may be information that they still need. That's all part of the process. So I give you the situation of 87-year-old Mrs. Callahan. She's 2 days post-pneumonia diagnosis. She's very thin. She doesn't eat much. She doesn't have family support. She's lying in bed, mostly just sitting up and not moving very much. And she's reluctant to move. And because she has oxygen, she's become restricted in her movement. Now, you and I look at that and we immediately say, oh yeah, she's possibly going to be at risk for pressure injuries. Students may not see that because they may be focusing on the pneumonia. So this is where you can start asking the questions. What's most relevant in the formation of pressure injuries? So in the course of doing a class on pressure injuries, you can say what in that history is increasing her risk, and then ask students to start prioritizing the risk factors, and they can start debating them. A good part about this also is helping students to see you have to collect your data first. Don't jump to hypotheses. You know, one of the big mistakes that students often make in the NCLEX type of questions is jumping to actions before having all the data that you need. Now, resources, you know, the National Council mentioned resources. I've been using Nursing Central for a long time. There's others that you can use, but I've really liked this because you can search for a search term and come up with all kinds of related information for whatever you're doing, whether it's medications, or in this case, I just searched for pressure injury and got information about what you would need from a history, what you would need from a physical exam. So you could look at things like where on the body do we want to be inspecting, and so the resources can show. So students don't have to necessarily memorize. But one of the interesting things, and this goes back to active learning strategies, is that if you are learning these things as you need them and practice using them, you actually will remember them better than if you just presented students with a photograph and then said try to memorize this. The other thing the resources do, as you can see on the screenshot on the right there, is the risk factors. So students can start to see, okay, here's the things that are related to patients in pain, mobility, weight changes, medical conditions, and things that could be associated with a pressure injury. The next step then is moving down to the analyzing cues. And analyzing cues, what the National Council says is what's requiring nursing care, what's developing some hypotheses, what is it that's going to be needed by the nurse to help the patient. This is also the time when students need to start developing multiple possibilities, not just come up with one answer, but what are some of the things that could be done. This is also the time when you start ruling things in or out. So you might have some initial hypotheses that you're starting to create, but they're maybe lower priority or may be more chronic than acute. And so you start looking at what's most important and what information do I need. The other thing, of course, is, because this is also part of collecting data, is what are the measurement tools that are available. So there's also things in your resources that you can find, like the Braden scale for assessing pressure injuries, for example, that can help show the patient's risk for injury. And so students that can come up with some possible causes that they're putting Mrs. Callahan at risk, and they may be in different priority. So they have things like having fragile skin, being incontinent, dehydrated, perhaps she's too immobile, perhaps she's undernourished. And so there's going to be more data that they might have to collect to either confirm or rule out each of these possibilities. And this is where you start then to prioritize. Well, what am I going to do? So you put your hypotheses in order. What's most likely causing the issue? What's least likely to be causing the risk for pressure source? So as you give the students more information about the case, they will get more information. So one of the questions that I ask is, what gives the most bang for the buck? If we could change these risk factors, what would help the most? So you can ask questions like, if she had more knowledge about what causes pressure injuries, would that help? Would that change things? If we increase the circulation to the area where she's experiencing pressure, would that help? How fast? Does she smoke? Would that have an effect? Again, this is just the hypothesis portion of the process. You're not coming up with your solutions just yet. So again, you remind students not to jump to the outcomes just yet, but get some ideas for what they want to do. One thing to do now is start prioritizing. This is great points for discussion, and you can use technology like Kahoot, where students can vote on things and put things in different priority. If you have an audience response system, some people call them clickers, that's another thing that you can do to get students, or if you can even go low tech and just put these priorities on a small poster board, have students come up and rearrange the posters into the order, and then have them vote on what they think is the best choice. And then you can give feedback to the students on the quality of their solutions. And so now that, use the word solutions, because now you're trying to generate the solutions now that they've decided the priority. So using those prioritized hypotheses, what do we expect as an outcome? What would we expect in the short term? What would we expect in the long term? And then also, what things do we expect to work best? What's our most likely, again, back to that, what's our best bang for the buck intervention? This is a good time to introduce searching the literature for ideas. Again, students aren't required to reinvent the wheel. A lot of research has already been done. There's evidence-based practice out there. And so you can have them, instead of just relying on what it says in their book or what you've said as a lecturer, let them explore, let them find what the literature says, and then that gives them a real world experience using the literature for something that would help their practice. So let's say the students have interventions of teaching, inspecting the skin, repositioning, keeping her skin clean. Then you can start asking more details about, well, how would you do that? How often would you do that? So you get into more specific ideas, more specific discussions about how they are going to respond and take actions. The actual taking of actions is a little more difficult in the model in a classroom setting. It's easier in like a simulation lab, and so you can also be doing these things that we're talking about today in a sim lab. But if you're in a more traditional classroom setting, sometimes this can be a little difficult. But it is a good place to have students discuss what solutions would they give, what are the highest priorities. Again, they have resources out there. The literature is giving them ideas about how they can do. I'm showing an example here of a slide from Nursing Central showing some prevention strategies. Now, you don't do them in order from top to bottom. You have to do them based on the context of the situation that you're presenting and have the students then discuss and explain why they would do them in the order that they did. This is also a good place that you can do practice of patient teaching. If you don't have a sim lab where you're practicing maybe physically moving a patient in a bed, you can do a role playing where you're doing patient teaching about pressure injury prevention and put one student in the role of the nurse and another student in the role of the patient, and you can try different scenarios with different age patients, different medical situations, and think about how would your patient teaching change. If you have equipment that you're using to prevent pressure injuries, it's always a good time for show and tell, bringing in the equipment, showing students, giving them a chance to practice, or at the very least, pass around the equipment. And then finally, we get to evaluating outcomes. And that's where you're comparing what you observe in your case with the expected outcome. What would show in improvement? What would show it being worse? How well did the interventions work? And could something else have been done? So in your classroom settings, this is the period where in your case studies, you are going to be giving some outcomes. Here's what happened. And don't just say everything is better, but maybe give them some examples of things where they have to decide, is this showing improvement? And again, what would their measurable outcome be? What would show them that things are actually getting better? Again, there's resources like the Nursing Central that show what the outcomes would be expected to be. And then they can then refine those generic outcomes to the specific case that you have given them. So you can then think about how am I measuring success with Mrs. Callahan in the situation? Do I expect my actions to affect those outcomes? Another thing you can do is find resources that have things like photographs of pressure ulcers that are gotten much worse, pressure sores that are improving. So to summarize then, clinical judgment's always been the goal of nursing education. Clinical judgment has always been the goal of the nursing NCLEX exam, but it has not been measured as well as it could be. And so the NCLEX-R exam is changing, And they're going to be testing all those stages that I just showed you, which we just kind of raced through. There's a lot to learn, a lot to practice. But I think it's really important that you're giving your students a chance to practice clinical judgment in the classroom in that safe environment, give them feedback about what's about their decisions, and ask yourself, in my classes that I'm doing today, am I just telling them about clinical judgment, or are they getting a chance to practice it? So that's my presentation for today, and we're now going to open it up to any questions or comments. Brian?
Thanks, Brent. Yeah, we did get a couple of questions. We actually got quite a few, so we have a couple that we're going to get to. If we
Okay.
get to yours, then Brent will answer them all, and we'll get them out to you over the next couple of days. So the first one is, can these clinical judgment teaching strategies be done in a large classroom?
Yes, they can. That's a good question. Sometimes people feel like I can only do a very straight lecture, sage on the stage type thing in a class, but it's not really true. You can divide students into small groups. You can give them case studies. You can give them written materials that even if they can't do it as a group, if you're doing an online class, for example, the students can do their work and on paper or type it into a screen and submit it so that they get. But the idea is you give them a small part of the process that they can demonstrate back to you.
That's fantastic. Okay, another one here would be, do I need to make test questions this semester like the new NGN type questions?
I would say no, but you don't, because they're not even sure if those questions are going to be used exactly. But I would say is that you would want to make sure that your questions are at our higher level questions, that they're analysis and evaluation, that you're asking your students to do things like prioritize, maybe not just say what's the best answer, but put your responses, give them 4 correct things and put them in the order in which they should do them, and maybe given a chance for them to explain why rather than just give them a straight up or down answer and then evaluate. Because that's I think what the NGN is trying to do, is say that no longer will you say there's only one right answer, but if you can give good complete answers, good explanations, then that should be considered correct.
Fantastic. Okay, I think we have time for one more. I'm a little nervous how students will respond to me changing from my current teaching methods from straight lecture to these new teaching methods. How in your experience have they responded?
Students like lecture. It's comfortable. They don't have to. They can put their laptop open. They can play on their phones. They don't necessarily have to pay close attention. It's passive. And if those of you may have attended my webinar in the fall on active learning strategies, or may have seen some, in active strategies, and that's really what we're talking about today. The students can't just sit and listen. And some students may not be happy about that. But I think if you can show them the value, they'll find that the class goes a lot faster, that they're more engaged. They come out of the class feeling like they've really learned something. So I think if you go in with a positive attitude, and the other thing that students always want to know is, how am I being graded on this? So make sure that you think about how they are going to be evaluated by you whenever you engage in any of these methods.
That's fantastic. Brent, can you go to the last slide just to show some people?
Sure.
If they're interested in contacting Unbound Medicine. So if anyone has any questions or interested in learning more about Nursing Central and how it can play a key role in establishing and developing clinical judgment in your curriculum, please reach out and contact us at sales@unboundmedicine.com. There was a couple of questions about, will the slides and the audio be available? Yes, we recorded this webinar. It will be posted to YouTube, and a link will be sent to everyone that attended or registered for the webinar. We'll also post it at our solutions page for Nursing Central at unboundmedicine.com. At this time, I'd like to thank Brent Thompson for his presentation, and for everyone that attended. We really appreciate it, and keep a lookout. We do these periodically, and we'll be doing one again very soon. Thank you again, and hope everybody has a great day.